Hello, everybody, and welcome to the Downsized, or this breaking news edition of the Downsized News. Of course, the judge has moved today to fast-track the FDA lawsuit for compounded Tirzepatide. And is it at risk is the question. So welcome to the Downsized. Lorraine and I are on an adventure using GLP-1 medications to lose weight together. And I've lost, 90 pounds. She's lost 50, so more than 140 pounds between the two of us. I'm Christopher Durham, and before we get started, please make sure to like and subscribe to our channel. Also, just a quick reminder, we are not doctors. I'm not a doctor. Lorraine's not a doctor. And since we're going to be discussing legal stuff, I'm also not a lawyer. So always consult a professional before making any medical or legal decisions. A federal judge has granted Eli Lilly and Company's motion to intervene in the lawsuit between the Outsourcing Facilities Association and the U.S. Food and Drug Administration, or the FDA. The case filed in the U.S. District Court for the Northern District of Texas focuses on disputes over compounded medications, or disputes, more rightly so, over the shortages of Tirzepatide, which is the patent owned by Eli Lilly. These include Tirzepatides based on base treatments widely used for weight loss and treating the disease of obesity, which we know as Mounjaro and Zepbound. Judge Mark Pittman approved Eli Lilly's request to join the case after plaintiffs withdrew their opposition. So essentially, the OFA was suing the FDA. The OFA said, hey, we don't think you did your due diligence and customers are going to be put at risk and all of these other things. We want you to come back. And it's been going back and forth over the last couple of months. After the FDA came back and said Tirzepatide was indeed still in shortage, the OFA has refiled their lawsuit, and we're going through the process right now. At the same time, Eli Lilly came to the court and said, hey, we haven't been involved in this, but it's our patent. We're obviously a party to this, and we want to be involved in the case. So the judge has approved Eli Lilly being involved in the case. Makes sense. I don't think anybody's surprised by that. Eli Lilly is, of course, the maker of FDA-approved GLP-1 medications, Mounjaro and Zepbound, and they're aiming to protect their interests as compounding pharmacies face increased scrutiny over their production of alternative branded drugs. So Lorraine and I have both taken compounded Tirzepatide. I've taken Zepbound and Mounjaro. We're intimately aware of the prices and the challenges of these medications. So we've been tracking this very closely. Our question becomes, who exactly in all of this is defending the patient, is defending you and I? Well, we know the FDA is defending its regulations and its own authority. The OFA is defending compounded pharmacies and their ability to provide medications. Eli Lilly is defending its patents and profits. But who's defending us, the patients? The 74% of Americans who are overweight or obese and are fighting for a healthier, better life. Doesn't seem like we're in the mix here. So let me give you a little bit more background on the lawsuit. The lawsuit challenges the FDA's enforcement actions against compounding pharmacies that produce medications containing Tirzepatide, which is the active ingredient in Eli Lilly's drugs Mounjaro and Zepbound. The Outsourcing Facilities Association, representing compounding pharmacies, argues that compounded Tirzepatide is legal under sections 503A and 503B of the Food and Drug and Cosmetic Act. They claim these facilities provide affordable medications for patients who cannot afford FDA-approved drugs. The FDA argues that compounded Tirzepatide violates federal law. It says that drugs bypass the agency's approval process and may pose safety risk. And they say that once the drugs are off of shortage, there's no longer a legal reason for compounded Tirzepatide to be created. So the FDA declared the shortage over not too long ago. The FDA recently declared the Tirzepatide shortage officially over. Eli Lilly boosted production of Mounjaro and Zepbound in 2023 and 2024. They claim resolving earlier supply issues that left many patients without access. We're skeptical of that, and I know many of you are. We continue to push back on whether these drugs are available to the consumer. During the shortage, compounding pharmacies stepped in to provide alternatives. These versions were often cheaper and easier to get, especially for patients without insurance, Medicare, Medicaid, or those of us facing delays or simply unable to get the medication to treat the disease of obesity. With the shortages According to the FDA and Eli Lilly resolved, the FDA has increased enforcement against compounded tirzepatide. We've seen them taking some actions against some of the research pharmaceutical and the pharmaceutical grade things, and we anticipate eventually they'll take some actions against some of the compounding pharmacies. The FDA argues that compounded versions are no longer justified. This has triggered the lawsuit that now is before the court. So let's talk about the court order. So it's a two-page court order. You can see it here. Not very long. Despite that, it's pretty dense. So Judge Mark Pittman's order addressed several key issues in the case. First, he granted Eli Lilly's motion to intervene, noting that the pharmaceutical giant has a legitimate interest in protecting its patents and its profits. Of course it does. It needs to protect its brand. The plaintiffs, who are the OFA, withdrew their opposition to Eli Lilly's involvement, clearing the way for the company to join the legal battle. I don't think anybody believed Eli Lilly wasn't going to get in on this. The judge scheduled a hearing for January 10th, 2025, so I believe that's Friday. One major issue is the FDA's handling of confidential information, which has raised questions about transparency and data sharing in the case. Pittman emphasized the need for clarity and fairness as the court moves forward. So essentially what the OFA had said is, in order for us to assess, for the court to assess whether these medications are in shortage, we need to see Eli Lilly's records. And Eli Lilly had given those records to the FDA. Well, what Eli Lilly said was, wait a second, you guys are all the competition, and these are trade secrets. We don't want to share them with you. So they're working out how or if they share any of these things. And the judge, in this case, Pittman, is that intermediary. In a significant move, the judge suggested consolidating motions. Now, here's where it gets interesting. This could turn the plaintiff's request from a preliminary injunction into a motion for summary judgment. According to Pittman, summary judgment acts as the mechanism for deciding a matter of law, whether the agency is consistent with the APA. In simpler terms, the court may decide the entire case quickly based on existing evidence rather than dragging it out. So it's hard to say what Pittman's thinking here, but the assumption is he believes he has the information he needs to make a decision, or that during this hearing they can bring the information they need for him to make the decision. Which way that goes, who knows? The outcome of the January 10th hearing could set the course for the rest of the case, or even if the case moves forward, if he makes a summary judgment. Depending on the ruling, compounding pharmacies may be allowed to continue their operations or face an abrupt halt. So if he says it's still in shortage and the OFA doesn't have standing to move forward with their case, then he makes a summary judgment, it's all over. This case could dramatically change the timeline for compounding tirzepatide. A judgment from the court on January 10th has the potential to end compounding entirely, leaving patients with fewer options. Or it could be a lifeline that extends compounded tirzepatide for a year or more as the court case unfolds. Now, we all know that the Mochis, the IVEMs, there's a bunch of them out there that believe they have legal standing, and this isn't going to completely end this whole legal saga. Their attorneys, so the large telehealth providers, the large compounding providers, believe by adding a B vitamin, by changing a dose, that they have legal standing and continue to compound. There's little doubt in my mind that Eli Lilly and Novo Nordisk will contest that. This will end up with a bunch of very expensive lawyers in court. For me, patients are at the heart of this fight. With 74% of Americans overweight or obese, this case could determine whether affordable and accessible treatment options remain available for those fighting to lead healthier lives. We believe these medications need to be more accessible and affordable. We must push for better pricing and access to life-changing treatments. I've said it before. Lilly could end this conversation almost immediately. They could walk in and say, we're going to come at the market with $199 a month, just to pick a number out of the air to match what some of the telehealth providers have been doing, and it would shut down compounding almost immediately. They don't have the money, presumably, and the profit is not there. So as we look at this, we don't know what's going to happen. We know we'll have an update from the court on the 10th. Either the judge is going to take the preliminary findings and say, let's move forward with the court case, or he's going to make a summary judgment. Whether that summary judgment is in favor of the OFA or it's in favor of the FDA remains to be seen. There's a little doubt in my mind there will continue to be legal challenges to all of this. So what we also know is that this will continue to follow under the FDA's statement from, when was it, last month, I guess, that basically the 503As and the 503Bs had 60 days and 90 days. They haven't changed that right now. So mid-February, mid-March to continue to, and they will not contest or, prosecute anybody. So nothing much has changed, but everything could change on Friday. Who knows? So let's see who we have here. Let's bring Lorraine on. Lorraine, come on over.
I feel like, on Saturday Night Live when the guys roll over to the...
And she's got her Hello Kitty shirt on.
Hi, I was taking down Christmas decorations today.
Introduce yourself while you're here.
My name is Lorraine Durham. I'm married to Christopher Durham, and I've lost 50 pounds on compounded Tirzepatide. So this news information is very near and dear to my heart, as I'm sure it is to a lot of you guys out there watching. So...
Oh, let's see who's here. Dave, I saw you earlier. Good job, by the way.
Don't think Lily can make that much medicine.
No, nobody thinks Lily can make that much medicine, man. I think that's impossible.
Yeah.
But,
I mean, it's highly likely it could go back into shortage again, right? I mean,
I think it's probable. It's not even likely.
It's been approved now for sleep apnea. So, I mean, even more people are going to be trying to find this medicine, trying to buy this medicine. And we all know that it's hard to find now anyway, even though they say it's out of shortage. A lot of people still can't find it.
Oh, let's see who we have on here. Any questions? Lovely one says she missed us because we didn't do a video. We're playing with video frequency. The weekends might be a time off for us. I haven't quite decided yet, but we thank you for missing us. Oh, let's see here. Kathleen, the Fernway Flipper, 5:01 p.m. Hello. From Australia.
Hello.
Difficult Nerd says,
Hey,
good
James.
morning. He's in Australia.
Yeah.
Michael Clinton says some think no decision will be made on Friday. I think we don't know what's going to happen, Michael. We just don't.
I mean, it just keeps continuing. Now, the whole thing about the summary judgment makes me a little bit more nervous, but who knows what the judge is going to say on Friday. I
mean, the judge added that in himself, so it's hard to say what the judge is thinking. I mean, he could do a summary judgment for or against. He could say, I don't have enough information. Let's move forward.
Mm-hmm.
Nobody knows. We just don't know. Shelley says, glad you're here to help us understand. Absolutely. Piggy asks no more. Hello, Piggy. How are you, sir? Too many folks are counting on this lawsuit to protect compounding. Be prepared Friday for this all in. There's no provision in the law for the FDA to not enforce the law if a shortage is over. Well, Piggy, I think you're right. Partially, I think the challenge is there's plenty of wiggle room that the compounding lawyers think they have. Yeah. So will they win with that wiggle room? I have no earthly idea. I guarantee you it'll go to court. Let's see here. He also says the only reason to not settle on Friday is OFA protecting their interest in money, not patients. No, everybody's making money off this. Everybody's making money but us. Okay? There's no altruism here. It's not that compounding pharmacies are sitting there going, we're going to save the world and help obese people. They're not. That's not what's happening. Neither is Eli Lilly. Neither are insurance agents or PBMs. Everybody's making money.
As much as I usually disagree with you, Piggy, I think you are 100% correct. Yeah. You know what? It's just one thing after the other, right? We've been going through this process since October. I know Mochi Health, the online provider I use for my compounded Tirzepatide, changed the dose levels of their medication, so they're different than the Eli Lilly doses. They've added B vitamins, niacinamide, so that makes it different than the.
Is that going to work in court?
That going to work?
I have no idea.
I mean, they think it's going to work, so I guess we'll see if that holds up. If this,
I mean, the
if they're
reality
told to
here
stop.
is compounding was never designed as a long-term fix for volumes of medicine, and it was never designed as an end run for a patent.
Well,
Just
then I
wasn't.
guess they should up their supply.
Well, no, I don't think that's. I think eventually what's got to happen is the healthcare system has to evolve and the law has to evolve to take into this account. Now, the laws, compounding laws, were not written with this thinking about it. So, what happens, I don't know. No surprise, says Lady Alex, says Big Pharma controls our healthcare. They have the power that the corrupt politicians bolster. If we had an NHS or Medicare for all, things would be different for our government. I think it's certainly time to reevaluate our healthcare system. It just seems dysfunctional. Does Big Pharma run it all? I don't know. I think they probably run a piece of it, along with the PBMs and the insurance companies and the hospital systems. And I mean, there's a lot of people to blame out there. Dave says, I think the confidential info is why Lilly got involved. Oh, for sure. No question about it, Dave. Jennifer says, hit the algorithm and hit that thumbs up. Please do. 45 likes out there and 193, 100 or 200 people on that.
Yeah.
No question, Dave. They don't want the info.
I wonder what's in that redacted info.
Well, I mean, I think it's all of their distribution and their stock and their quantity. And I mean, it's everything about their way they're doing business.
I mean, but why would they not want that for public information?
Just as general standing, would you want to give it out?
I mean, if they're not in shortage, then they shouldn't. I don't understand the problem with just, are there, supply numbers and I don't understand the problem. But there's probably more to it that we just don't even know.
We probably never will see those documents.
Yeah, no. It doesn't matter, but it's weird.
Lady Alex, only the U.S. and New Zealand show drug commercials on TV.
Saw a Lilly commercial on TV last night, the Golden Globes for weight loss medicine.
It's another one of those pieces that just should go away. I mean, that's legislation that should happen today and should be bipartisan. Why you can advertise prescription drugs, I don't get. It doesn't, and it hasn't always been legal. It only happened in the 80s, in the late 90s that it became legal.
I mean, why would you be against advertising drugs on TV?
Well, first of all, it adds cost.
They're making billions per quarter.
It's still, I don't care what they're making. I'm from the American perspective, from the citizen perspective.
So you think the cost of the medications would go down if they did not advertise? That's what you're trying to get to?
I think the challenge is, number one, it adds cost. Number two, it encourages really just bad medicine. So a doctor should be working with the patient to get the right medication, not watching commercials and wasting money on it.
I mean, I learn about new medications on TV all the time that maybe I then want to go ask my doctor about.
You're playing devil's advocate, I know, darling, but it's
no, I know. I don't think having less information
it's not
makes
about less information. It's about not wasting the money on marketing. It's just unnecessary. Dave says, unfortunately, if those on compounds, the FDA is within their legal right. Perhaps the Chevron ruling comes into the play. Maybe. Who knows?
What's the Chevron ruling?
There was a whole thing about the FDA, about government agencies not being able to write their own regulations and do their own thing. And it gets really complex. Dave's done a whole video on the Chevron ruling.
All right. I'll have to go watch it, Dave.
Lady Helks and the FDA is, I don't know that I believe the FDA is corrupt, but I think there's certainly a lot of people who do believe that. Hello, Traces of Twan. Let's see here. Piggy Ass says, grasping for Chevron is a reach. The law grants EPA law enforcement of the law. This is not a case of FDA expanding or using discretion in interpretation of the law. I think the problem is if you look at the definitions and what they're talking about in the 503 rules, it's pretty fuzzy. It really is. So let's see here. And yeah, Dave, you're right. We'll see. Little Farm in the Country says, I stocked up with a 9-month supply to reduce the anxiety. We have a 3-month supply that will be here today or tomorrow, I think.
Yeah, I placed an order on, was it the 3rd? It's going to be here tomorrow, a 3-month supply from Mochi. So I think someone in the comments is asking about the bud dates on those. So it'll be 3 vials. I I don't know what the bud dates are. Usually when I get when I get the vials from Mochi, their bud dates had been like 6 weeks out, 8 weeks out. So yeah, it'll be interesting to see what the bud dates will be on this next shipment I get.
She says, thank you for the update. Piggy says, Lilly can make more than enough at the price they charge. Those paying 200 versus 1,000 will wash out a huge demand. Oh, you're right. I mean, they are using their pricing to moderate demand. There's no question about it. But if they get all of this in production, the target of getting this in the hands or the bodies of 74% of Americans is so huge. I promise you they'll go after it sooner rather than later.
The problem, they certainly want to make more than enough. They physically cannot. That's why they're building these plants in North Carolina and in, where's the other one? Indiana or Wisconsin.
And there's a couple globally.
They're trying to make it as fast as they can. They want to sell all that they can.
Tammy says, I have a very serious question to ask here. Okay. Tammy, ask away.
What's the question, Tammy?
Mel Bethel, who's a member, says hello.
Hey, Mel. Nydia, could you please share the bud dates when you receive the Mochi 3-month supply? Yeah, I will for sure. I'll put them on my Facebook page, which is called Tirzepatide Tips and Tricks with Downsized, if you want to join that.
And we'll do it. We can add them into a video. Dave says on the one thing's for sure, nothing is ending on Friday. I don't think anything's going to end fully on Friday. There will be so many more lawsuits. Mel, so to recap, why is Friday significant? So basically, the judge in the Texas case gave Lilly standing, and when they gave it, because Lilly had petitioned to be part of the lawsuit, obviously they are the patent owners of Tirzepatide, so it makes sense. So the judge in the lawsuit said, okay, well, I'm going to do this preliminary piece, but I also am going to consider doing summary judgment, which means I could just decide the whole darn thing because we have enough information on Friday. If that's the case, he could decide that to kick the OFA's case out, they don't have standing, there's no, and the FDA's shortage announcement was completely legal, move on with the table. He could decide, hey, we're going to continue this case. I need more information, right? Or he could decide, oh, well, but it's Friday will change something.
I think Tammy put her question.
Let's see if we can find your question, Tammy. Nancy Ann says 46. I don't know what that means.
So being under my goal weight, is there anyone else like myself? You don't want to go off the medication, but yet you want to go off the medication.
Okay, let's get to word. Oh, Tammy, I've been in maintenance for about 8 weeks, and my dilemma is, has anyone had issues of problems tried titrating down? I am currently 10 to 15 pounds under my goal weight, intentionally buffer zone.
You haven't found your maintenance dose yet. So, and I've heard a couple of people say this, I think was maybe Kathleen. Anyway, as you titrate down in maintenance, if you're still losing weight, that's not your maintenance dose. So you need to get to that lowest dose where your weight loss then just goes kind of to zero, or maybe you just bounce around up a pound, down a pound. If you're still losing weight, then keep going down, kind of like the reverse. If you're losing weight, you keep going up because you stop, and then you go up and you stop. So anyway, same thing, only in reverse.
And the unfortunate truth of the matter is, I think there's no perfect dose for all people. For maintenance, you're going to have to find the dose that works for you.
Yeah.
Lilly has some research in the field right now called Surmount Maintain, where they're doing a bunch of research on maintenance and testing at the highest dose that people achieve, testing at 5 milligrams, testing placebo. So they will come back with more information. But it's still a wild west of that. Oh, let's see here. Oh, Dave says he thinks they sat on sellable doses in Q3. Maybe, who knows?
That would. Do you think so? You really think so, Dave? They'd rather sit on it than sell it. That would really make me mad if they actually did that.
Anything's possible. Let's see here. Yeah, Piggy says redact info makes sense. It does. I mean, they have inventory levels at warehouses that would become targets. Yeah, I mean,
like where? I mean, but they're. I mean, I guess from that point of view, yeah, this stuff is is expensive. Could you imagine a Zep-bound heist, Manjaro heist? I mean, it's worth a lot of money.
So Lady Alex says, we can complain all we want, but nothing will change as this system will never change. Well, Lady Alex, the system has changed 10 times in the last 100 years. It could change 10 times in the next 100 years. PBMs didn't used to exist. There didn't used to be advertising for medications. I mean, things change. So
I mean, hopefully Eli Lilly, gets some of this information that we're mad as hell. And we're not going to take it anymore.
I don't know that Eli Lilly cares if anybody's mad, but I think
maybe they do.
With 74% of America being overweight or obese, that is a larger voting bloc than voted in the last election by almost double. So there is a voting bloc out there that can go to the polls and vote for what matters to them. So if fighting the disease of obesity and your health matters, then vote for people who are going to help us. Patricia says, if everyone fills the name brand in just 1 week, it would be back on shortage.
Exactly.
I know a lot would not be able to get it. It's not about the price anymore. It's about having enough to fill.
Yeah.
Yeah. No, I think you're absolutely right.
Shortage. It's just going to keep bobbling around. That's what I think is going to happen. Hello.
Oh, that's the same question you answered. Sorry.
Well, go back to that for a minute. So being under my goal weight, is there anyone else like myself? You want to get off the medication, but yet you don't want to get off the medication, right? So keep going down. We're not doctors. We don't, this is not medical advice, but keep going down. And if you get to that lowest 2.5 dose, maybe stretch out the number of days between doses. So maybe you go 10 days between doses. Maybe you go 2 weeks. Maybe you go further than that. Maybe you microdose. I mean, everybody's going to be different, and you just have to find what's working for you. I don't want to get off the medication because I know once I'm off of it, that weight's going to start creeping back up again.
Oh, and here we have Piggy Ask No More. Thank you, sir. Read that, Lorraine.
Contact your representatives to get the law changed. Without that, Big Pharma will always win.
Well, and remember, it's not just about Big Pharma. It's certain, but it's also PBMs. It's also insurance companies. I mean, our entire healthcare system is built to profit off of sickness. I mean, it doesn't have to be.
Who knew so much about the healthcare system a year ago? Not me. I mean, I just went to the farm, got my prescription filled at the pharmacy, and went about my business. So, we've all learned a lot, and we're telling people how it works out there. So hopefully more people will be able to, convey that to our lawmakers.
The Turtle Diaries, weight loss.
Putting in my 3-month mochi order just to be safe. Yep. I mean, I've got one, should be here tomorrow, according to FedEx. So I would, if you don't have a reorder in now, I'd put one in right now. Chris Blake, thanks for keeping us informed. You guys are great. Thanks, Chris Blake. That's very nice. The medication is almost addictive, in my opinion. I mean, we're definitely addicted to the results.
Yeah, I mean, it is not actually an addictive medication. That's not the way it works. But and no, Tammy, we're not going to block you. As long as you're not being nasty, we're not going to block you.
Why would we block her?
But I mean, here's the thing. This medication is a treatment for the disease of obesity. It is not a cure.
Right.
So if you, and I don't know you, I don't know your situation, and I'm not your doctor, I'm not a doctor at all, but if you have the disease of obesity, it didn't magically go away because you got skinnier. Skinny is just the physical manifestation of that disease. So we believe that we will be on some form of this medication probably for the rest of our lives. And we believe that the science and the technology will change such that eventually this price will come down. There will probably be daily pills. There will be ways to manage this that are basically equivalent to the blood pressure and the cholesterol pills that I've been taking for the last 25 years that I no longer have to take. Mm-hmm. So if the price comes down, the accessibility becomes easier, there's no reason to be concerned about this. It is a medicine to treat a disease that is chronic and complex, and it's a good thing.
Kind of off topic, I'm using Zepbound currently. If compounders remain in business and I need to use them, how do you get a 9-month supply? So all of these different compounding pharmacies and online providers have different amounts that you can buy at one time. So I use Mochi Health. You can go to joinmochi.com. You can get a 3-month supply of compounded Tirzepatide currently for $199 times 3. So I think that's $597. There's a membership fee of $79 a month. So, and I think the 3-month membership fee is around $200. So you can go check that out. There's different online providers, different compounders that are offering longer
you just have to look around, and basically all telehealth companies work the same. So you go to their website, you sign up, you talk to their prescriber, they write you a prescription to their compounding pharmacy, and it gets shipped via FedEx or UPS, wherever. Now they use a variety of compounding pharmacies around the country. A lot of the names are very, very similar. So you'll see Hallandale and Red Rock and a bunch of them used by a lot of the telehealth companies. But the bud dates, the best used by dates, vary depending on the kinds of preservatives and the technology they're using to seal the bottles and the shipping. There's a lot of things that varies by. But you just have to look around and go do it. If you think you want to do that, I would say do it right now. Do not wait.
Yeah,
because I don't know what happens Friday or.
Yeah.
I mean, in all likelihood, we're good until February, March because of what the FDA has already said, but it could all change again.
Mm-hmm.
Lady Alex, you're right. I mean, go lobby, go talk to people. Well, we've got to change the system. Let's see here.
Yep, I'm below my initial goal, but now only maybe inject once per month. Could use something in between 2 to 4 milligrams, in my opinion. This is a real issue. Yeah, I mean, I agree. And I know, Mel, you're on, I think, Zepbound or Mounjaro. I know you get your medication from the pharmacy. So, yeah, I mean, hopefully at some point the big pharma companies, Eli Lilly, Novo Nordisk, will realize that personalized dosing, is something that people will need, especially as we get further along and people figure out really what works best for them.
Oh, let's see here. Kathleen says protective orders to keep business info secret are very standard. Yeah, they're standard. I mean, none of that surprises me. I wouldn't. If I were Eli Lilly, I would go, no, I'm not giving you that.
Mm-hmm.
Mel says, yes, things can change. Anything can change. Nancy says things could also change when the new administration takes over in a couple of weeks. I'm positive things will change. Whether those things will be better or worse, that I don't know. But things will change. And then 4 years from now, when that administration is over, things will change again. We have a government and a system that is built on change. I mean, we're built on the peaceful passing on of power, right? So things are going to change. You
certified the results today.
Yeah, you can vote for different people. We can change the way our health care systems works. It hasn't always worked like this. Lauren says, if I'm still titrating up, how would I get a 3-month supply?
It's a great question. I would talk to your customer service. I would call them and call the customer service. You might be able to get 3 vials in 3 different doses.
Most of them won't, but your better bet would be to buy the highest dose and then draw out
vial
what you
can, and then you just pull out what you need. That would be what I would do.
MS Mong 123 research grade is the same thing. We do not advocate research grade. Mm-hmm. Those physically say that they are not for human consumption, and we do not recommend that.
No.
You do not know what you're getting. You do not know that it's the same thing.
Please don't inject anything into your body that says not for human consumption. I know there's a lot of gray market talk out there. We do not support that. So we're not talking about that.
Let's see. Alex is just complaining about the politics. Yeah, I'm with you, Alex. Let's see here.
I suspect generic semaglutide and generic liraglutide are going to change the game, as well as competitors. Prices will have to drop because competition will be cutthroat. So we just recorded a news segment today about generic
it'll come out right after this.
So yes, generic liraglutide is coming out, and we even said the price, like
It's like
we thought.
179 or
Yeah,
something.
very reasonable price. Now, of course, liraglutide doesn't work as well as semaglutide or tirzepatide. So, but it might be something to fill in the gaps as we, struggle to get medication and at an affordable price.
So it's all coming. Lady Alex, a for-profit system does not operate in the best interest of any of us. You're right. And it hasn't always been for-profit. So there's ways to get this. I mean, if we could get PBMs out of the system, and PBMs are a recent thing. They haven't been at the scale that they are, honestly, since the last 3 elections. It could change. I mean, that would take, if you believe what Novo Nordisk said in the congressional hearings, that would take 74 cents out of every dollar that's being spent out of the system and reduce prices almost immediately. It can change for sure. It can change. Quick recap for ones that got in late. Yes. So the judge in the OFA, the Outsourcing Facilities Association versus the FDA court case on the Tirzepatide shortage came back today and said, first of all, he awarded Eli Lilly standing in the case because Eli Lilly obviously has a relevant position to this. They own the patent, it's their drug, which did not surprise anybody. He also said he would maintain the hearing on January 10th, which I believe is Friday, and that he would entertain not just doing the preliminary injunction, but doing a summary injunction, which meant that he thought he could have currently or could get in that hearing enough information to make a decision about whether the FDA followed the regulations and could decide that Tirzepatide was in shortage or not. So the judge theoretically will come back on Friday, listen to the hearing and say, yes, it's still in shortage, the FDA can do this, or no, it's not in shortage, the FDA won't do it. Or he could say, I need more information, and the court case gets extended out however long the court case takes. All of that could, any of those things could change what's happening. The reality is, if he comes back and says, case is over, the FDA did what they were supposed to do, it's all good, you would almost immediately probably see Eli Lilly issue cease and desists, and the FDA go after some of the telehealths and the compounders, and then their lawyers would come back and it would go back and file more cases because they all are making money and they want to keep making money. And this legal battle will continue, and we'll be doing more lives.
Just keep reordering it till you can't reorder it anymore.
That is pretty much the answer.
That's what I've been saying.
Difficult nerd says Sandoz will be releasing a generic semaglutide in Canada in 2026. They're ready to go, which seems to also change American dynamics. Yeah, we've reported on that too. I mean, it's a short trip across the border.
Saw my mochi provider today, much more thorough than my last company. Really like them. Thanks, Lauren. Well, you're welcome, Shelly. Yes, I'm glad you had a good experience.
Thanks for being a member, Shelly. Yes.
Tammy in Florida, I really appreciate you both. I suggest you to everyone, including my friends and family. Well, thank you, Tammy in Florida. We appreciate that. So if you would like and subscribe, then that helps YouTube know that you like us. You really, really like us. And it will suggest us to other people looking for information on Tirzepatide, Zepbound, Mounjaro, semaglutide, Ozempic, Wegovy. So.
Oh, Tammy in Florida gave us a super sticker. Thank you, Tammy.
Thank you. Thank you, Tammy.
Little dancing girl there.
That's great. Thank you, Tammy, so much. We're going to be in Florida
in a couple weeks.
At the end of January. Can't wait. Because it's cold here. It's cold. Did y'all get snow today? It like snowed across the whole thing. We just got cold rain. Jojo does not approve of the cold rain.
No, Jojo does not.
Mochi is asking, reason for changing medicine. Best response for this? Last dose I ordered was 4.4. This time I'm trying to order 3 months of 6.6. Just tell them your weight loss has slowed or stopped. Need to go up in dose. If that, and you might do better with calling them sometimes and clicking from the drop down menu if it doesn't really make sense. I know they have that box you can type in, and they ask for your last weight and they ask for your current weight, and you can put those in. And I don't think anybody's really keeping up with your weight and what's happening. So
Yeah.
But if you could call, it might work better, because sometimes English is a second language.
All right. So currently there's 265 people out there and 103 likes. Thank you, everybody, for joining us this afternoon.
There's a snowstorm headed to my area where the court is. The courts may not be open. Oh, you mean the court?
Oh, the Texas courts may not.
Well, I thinking of pickleball court. The courts may not be open on Friday. They're in Texas, right?
They're in Texas, yeah.
Is it? And it's supposed to snow. I think I saw something that said Texas was supposed to get snow.
That's where she says she lives, apparently. Yeah.
Oh, where the court is. Indeed. Okay. Well, It took me a minute to remember that it was Texas and blah, blah. All right. Thank you, Pink Magnolias. So, yeah.
All right. So if there's not any more questions, we're going to be out of here. Stay tuned. Probably in about 15 minutes, there will be a new episode of the news hitting the airwaves.
The news. We recorded
that does not have this story in it because we recorded it this morning, but it says, hey, go watch this video.
But it does talk about the generic liraglutide, which you might be interested in. So,
but yeah, and then make sure you join us on Wednesday. Let's see.
Summary judgments only apply when there are no disputed facts and the judge can make a decision solely on the law. From the complaint, the legal issue will be whether the Administrative Procedure Act applies.
The APA,
All right.
That is correct. So apparently the judge thinks he has what he needs. Or he doesn't. I don't know. We'll have to wait and see.
I mean, I guess the outcomes are the judge says,
I can make a summary judgment, in which case I have the information.
Right. So the judge is either going to say compounders can continue or compounders
Well,
can't
it's not
continue.
about compounding.
It's
It's about the
compounding.
FDA's ruling.
It's about the FDA's
the compounding
ruling
just
on,
happens to be impacted by.
It's about whether or not the FDA was correct by putting this into off of the shortage list.
Correct.
Okay. So
basically the OFA said they didn't follow all the correct regulations.
They didn't follow, right. They were, and then Eli Lilly said, oh, well, here's all of our top super secret information.
No, I'm sure they haven't given them to anybody yet.
Well, that's the redacted stuff in the
FDA
and the paperwork.
Sure.
And that's why Eli Lilly wanted to be a part of this, because they.
Well, even beyond that, even if there wasn't, that's still their patent.
Yeah, it's their patent.
Still their
I mean,
brand.
they made this stuff. Like, we are very thankful that they did. So
yeah,
I don't know. Reorder now. Reorder until you can't reorder.
All right. So you'll see the news if you're subscribed. Which you hit the subscribe, and then probably 20 minutes you'll get a ding, and it'll go ding. Hey, there's a new episode of the news.
Y'all should
all does
not
have this story on it.
Y'all should all subscribe and all should hit the like button. And then we'll be back on Wednesday with our regular live at 7 p.m. Eastern Standard Time. And we'll be back with details about the Downsized Cruise.
Yeah, for sure.
In June. And if you go to thedownsized.org, how did you know I was going to say that? Thedownsized.org, you can sign up for our email list, and we'll be sending an email with the cruise details too. So go to the website, sign up for the email list. I think we've sent out one email so far, so we are not spammers, because ain't nobody got time for that, right? We certainly don't have time for that. So,
all right. That's it for the news. So if you are using compounded Tirzepatide, get your order in today, because as of right now, you've basically got through February or March. As of Friday, who knows?
Did you have to? Is my Mochi code in the comments?
The Mochi code is in the comments.
If you want to join Mochi Health, you can save $40 off on your first order if you use my code. It's in the comments. I think it's QIYG, the letter O, and then 8. So yeah, you could save $40, and you can get a 3-month supply right now through Mochi. You have to talk to their online doctor. Someone told me online, like today, that their appointment with their doctor was like super fast. So I think they're trying to do everything they can
And
to
yours shipped really,
facilitate
3 months supply shipped really fast, right?
to facilitate the fast processing of these orders. So that's all I know. That's all I know, guys.
Yep. All right, that's us for this evening. Who knows? Maybe we'll be back tomorrow. Actually, we'll be back with a video tomorrow, but live streams for sure on Wednesday, probably on Friday. We'll see what happens. All right, that's us for today. We're the Downsized. I'm Christopher Durham.
I'm Lorraine Durham.
See you next time.
Bye.